Alcohol-related liver disease, P2. Symptoms of alcohol-related liver disease. Heavy drinkers usually first develop symptoms during their 30s or 40s and tend to develop severe problems about 10 years after symptoms first appear. Fatty liver often causes no symptoms. In 1/3 of people, the liver is enlarged and smooth but is not usually tender. As alcohol-related liver disease progresses to alcoholic hepatitis, symptoms may range from mild to life-threatening. People may have a fever, jaundice, and a tender, painful, enlarged liver. They may feel tired. Heavy drinking can make the bands of fibrous tissue in the palms tighten, causing the fingers to curl, called Dupuytren contracture, and make the palms look red, called palmar erythema. Small spider-like blood vessels, spider angiomas, may appear in the skin of the upper body. Salivary glands in the cheeks may enlarge, and muscles may waste away. Peripheral nerves, nerves outside the brain and spinal cord, may be damaged, causing loss of sensation and strength. The feet and hands are affected more than the upper legs and arms. Men who drink heavily may develop female characteristics, such as smooth skin, enlarged breasts, and decreased body hair. Their testes may shrink. The pancreas may become inflamed, called pancreatitis, causing severe abdominal pain and vomiting. People may become undernourished because drinking too much alcohol, which has calories but little nutritional value, decreases the appetite. Also, the damage caused by alcohol can interfere with the absorption and processing of nutrients. People may have deficiencies of folate, thiamine, other vitamins, or minerals. Deficiencies of certain minerals can cause weakness and shaking. Also, nutritional deficiencies probably cause or contribute to peripheral nerve damage. In heavy drinkers, thiamine deficiency can lead to Wernicke encephalopathy, which can cause confusion, difficulty walking, and eye problems. If not promptly treated, Wernicke encephalopathy may result in Korsakoff syndrome, coma, or even death. Korsakoff syndrome causes memory loss and confusion. Anemia may develop because bleeding occurs in the digestive tract or because people develop deficiencies of a nutrient needed to make red blood cells, certain vitamins or iron. Symptoms may also result from the complications of cirrhosis, see introduction, above. After cirrhosis develops, the liver usually shrinks. Liver cancer develops in 10 to 15% of people with cirrhosis due to alcohol abuse. Diagnosis of alcohol-related liver disease. A doctor's evaluation of symptoms. History of heavy alcohol use. Doctors suspect alcohol-related liver disease in people who have symptoms of liver disease and who drink a substantial amount of alcohol. Doctors may give the person a questionnaire to help identify whether drinking is a problem. Doctors may also ask family members how much the person drinks, see screening for alcohol abuse. There is no definitive test for alcohol-related liver disease. But if doctors suspect the diagnosis, they do blood tests to evaluate the liver tests. A complete blood count to check for a low platelet count and anemia is also done. Liver imaging tests are not routinely done. If ultrasonography or computed tomography is done for other reasons, doctors may see evidence of fatty liver or portal hypertension, an enlarged spleen, or accumulation of fluid in the abdomen. A technique called ultrasound elastography may be done to determine how stiff the liver is. A stiff liver indicates fibrosis. For this test, ultrasonography is done while pressure or vibration is applied to the liver. This test often makes a biopsy unnecessary. Even if examination and test results suggest alcohol-related liver disease, doctors periodically check for other forms of liver disease that can be treated, especially viral hepatitis. Other causes of liver problems may coexist and, if present, must be treated. Liver biopsy is sometimes done when the diagnosis is uncertain or when liver disease appears to have more than one cause. Liver biopsy can confirm liver disease, provide evidence that alcohol is the likely cause, and determine the type of liver damage present. It can also identify whether iron has accumulated in the liver. Such accumulation may indicate hemochromatosis. If people have cirrhosis, tests for liver cancer are done. They include ultrasonography and blood tests to measure levels of alpha-fetoprotein, which are high in about half the people with liver cancer. Prognosis for alcohol-related liver disease. The prognosis depends on how much fibrosis and inflammation are present. If people stop drinking and no fibrosis is present, fatty liver and inflammation can be reversed. Fatty liver may completely resolve within 6 weeks. Fibrosis and cirrhosis often cannot be reversed. Certain biopsy and blood test results can help doctors predict a person's prognosis better. Doctors can also use formulas and models, which combine various test results, to help predict prognosis. Once cirrhosis and its complications, such as fluid accumulation in the abdomen and bleeding in the digestive tract, develop, the prognosis is worse. Only about half the people with these complications are still alive after 5 years. People who stop drinking tend to live longer than those who do not stop drinking. Treatment of alcohol-related liver disease. Stopping drinking, abstinence, and assistance in doing so. Treatment of symptoms and complications. Treatments for liver damage. Abstinence. Abstinence is usually the best treatment. Other than liver transplantation, abstinence is the only treatment that can slow or reverse alcohol-related liver disease. In addition, it is available to all and has no side effects. Because abstinence is difficult, several strategies are used to help motivate people and to help them change their behavior. Strategies include behavioral therapy and psychotherapy, talk therapy, often as part of a formal rehabilitation program, as well as self-help and support groups, such as Alcoholics Anonymous, and counseling sessions with a primary care doctor. Therapies that explore and help people clarify why they want to abstain from alcohol, called motivational enhancement therapy, may also be used. Drugs. Drugs are sometimes used but only to supplement behavioral and psychosocial therapies, see detoxification and rehabilitation. Some drugs, such as naltrexone, Namphena, baclofen, or acamprosate, help by reducing withdrawal symptoms and the craving for alcohol. Disulfiram helps because it causes unpleasant symptoms, such as flushing, when people take it and then drink alcohol. However, disulfiram has not been shown to promote abstinence and consequently is recommended only for certain people. Treatment of symptoms and complications. Doctors treat the problems caused by alcohol-related liver disease and the withdrawal symptoms that develop after people stop drinking. A nutritious diet and vitamin supplements, especially B vitamins, are important during the first few days of abstinence. They can help correct nutritional deficiencies that can cause complications such as weakness, shaking, loss of sensation and strength, anemia, and Wernicke encephalopathy. Supplements can also improve general health. Often, if inflammation is severe, people are hospitalized and may need to be fed through a tube to receive adequate nutrition. Benzodiazepines, sedatives, are used to treat withdrawal symptoms, see emergency treatment. However, if alcohol-related liver disease is advanced, sedatives are used in small doses or avoided because they can trigger portosystemic encephalopathy. Treatments for liver damage. Abstinence is tried first. Several drugs, including some antioxidants, such as acetinosyl L-methionine, phosphatidylethylamine, and metadoxine, and drugs to reduce inflammation, may be useful, but further study is needed. Many nutritional supplements that are antioxidants, such as milk thistle and vitamins A and E, have been tried but are ineffective. Corticosteroids can help relieve severe liver inflammation and are safe to use if people do not have an infection, bleeding in the digestive tract, kidney failure, or pancreatitis. Liver transplantation may be done if the damage is severe. Transplantation enables people to live longer. However, because about half the people start drinking again after transplantation, most transplantation programs require that people be abstinent for 6 months to qualify. More information. The following are some English language resources that may be useful. Please note that the manual is not responsible for the content of these resources. Alcoholics Anonymous, an international fellowship of people with a drinking problem who rely on a 12-step program to support each other in overcoming the obsession to drink. American Liver Foundation hosts community education programs that give an overview of all aspects of liver disease and wellness. Also provides support groups, information on finding a physician, and opportunities to participate in clinical trials. Hazelden Betty Ford Foundation, provider of outpatient and residential substance use and addiction recovery programs. Let me know what do you think. Looking forward to your comments.